My name is Jim Capapiano. I'm 57 years old. I'm from New Jersey. I'm a patient of Dr. Kaufman's. Symptoms developed when I was at work. I was a construction worker on a job site, and suddenly out of nowhere I'm getting shortness of breath where I never had it before, and it progressively got a little worse. I got nervous, so I went into a walk-in clinic, and they saw something on my x-ray, and I went for testing. I did a sniff test and other various tests, and I was diagnosed at that point. It totally changed it. I was fairly active, very active prior to the diagnosis, and it kind of handcuffed me. I was unable to do most of the things I just did commonly. Even on the job site, I was affected greatly on the job, and it wasn't getting better. It was only getting worse, and I was in a bad place for a while. I was going to a pulmonologist for 2+ years, and we're getting nowhere, and it wasn't getting any better. Again, it was getting worse. And I remember asking him early on, if I don't have a lung issue, why are we treating the lung and not the cause of it, which was the nerve? And he kind of blew me off, like, you can't, basically, is what he told me. And I went with it because he was my doctor and I trusted him. I didn't know any differently. And so I did some research on my own, found Dr. Kaufman 2 years before I initially saw him, and I was blown off by this doctor. Like, you don't want to really see him, you don't want to do that, it's not the proper thing to do or whatever. And like I said, we were going nowhere. And my wife saw that I was getting a little bit depressed or whatever. And we were on the beach one day, and she says, well, what about this Dr. Kaufman guy? She was doing some research on her phone. And I said, that's the guy I was telling you about 2 years ago. And she goes, what do you got to lose? Call him. And I did. And my only regret is I didn't do it 2 years prior, because I'm feeling pretty good right about now. When I first met Dr. Kaufman, I was very impressed, actually, because he was honest. I felt, he wasn't trying to sell me something that was a sales pitch, for lack of a better word. He was honest about what he expected the surgery to be, what I expected the surgery to be. More importantly, he told me what not to expect, and it wasn't like it wasn't going to be an overnight miracle thing. There was going to be some work involved to get better. And pretty much everything was spot on from when he told me that day to where I'm at today. He did it basically as a nerve bypass. He took a nerve out of my calf and bypassed the phrenic nerve in my neck. The surgery went pretty much without any kind of a hitch that I know of. I had a incision in my leg, obviously, and in my neck. Recovery was, it really wasn't pain. It was uncomfortable. It's surgery. But for the most part, it was effortless as far as I was concerned. Recovery went well. Post-op was minimal. Just normal wound care and stuff like that. It was pretty much, a lack of a better word, flawless. I don't know if that's proper, but that's the best I can describe it. The biggest challenge during recovery was, in the beginning, it was a slow pace. The first couple months, I really didn't notice much difference at all, I'm not gonna lie. But shortly after that, things started to progress pretty rapidly. I was doing physical therapy, probably, I would say, like 1 month out from surgery. I don't remember exactly, but I did that once a week. And she was great. She gave me a bunch of exercises, which I did at home. You definitely have to put the time in. The surgery isn't going to be a miracle cure. You're going to have to put a little effort in it on your own to get to the maximum effect of it, I think. And it worked. For me, it worked. The physical therapy wasn't grueling or anything like that, but it's difficult. You're still not breathing normal, right away, so it's a little taxing in the beginning. But as you see progress, I think, like with everything else, you start to build on that. And that's pretty much what got me to where I am now. My surgery was 1 year ago this month, actually. it's a life changer. Let's put it that way. Yeah, from where I was and where I was going to, because I wasn't getting any better. I was only going to get worse. And where I'm at today, I'm pretty close to normal. If I could tell anybody, do your research. Just look and see what your alternatives are than just seeing your pulmonologist and him telling you, "Oh, wait it out, wait it out." I would absolutely suggest getting the surgery. I mean, for me, looking back on it, it's a no-brainer. You have to do it. You see Dr. Kaufman. He's honest. He's upfront. He's going to tell you what to expect, what not to expect. There's going to be some work involved to get to a full recovery, but it's worth it. It's absolutely worth it. I highly recommend it. Let's put it that way.